Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Okay guys, today let's look at those cases, case 10 and the 5 multiple choice billing and reimbursement questions that I left with you on Friday. Now remember we started with an inpatient face sheet. 62-year-old female was admitted with abdominal pain and hypertension, but her discharge diagnosis is acute and chronic cholecystitis and cholelithitis. So they've got inflammation, chronic and acute inflammation of the gallbladder, and stones of the gallbladder. She also has hypertension, hypokalemia, and a urinary tract with E. coli. A laparoscopic cholecystectomy was performed. Gave you the discharge summary that pretty much gives you the same information, but remember, a discharge summary is a summary of the hospital stay. So see where it has the hospital course and the lab data. Here is your history and physical. Upon admission to the hospital, the history and physical must be done with admission. So here you're coming in with abdominal pain and vomiting, gives you a little bit of history on the patient, talks about her past medical history, hypertension, herniated lumbar and cervical disc, requiring laminectomies. She's got anxiety and she's status post a hysterectomy for reason unknown. It identifies the medications that she's currently taking as well as her social history and a review of her body systems. Again, there's the laboratory data, and the assessment says cholecystitis and urinary tract infection, as well as the plan for that hospital stay. Going on down, you'll see the procedure note or operative record. This is a summary of the procedure that was performed. She had a laparoscopic cholecystectomy. So again, there's a description of the procedure, and because the gallbladder was removed, you have to know any body part removed requires a path report. So the specimen was a gallbladder, which showed, based on the path report, acute and chronic gangrenous cholecystitis and cholelithiasis. And then there's progress notes. Remember, as long as they're in acute care, there should be progress notes every day that they're in acute care. As I said before, subacute every 3 days, long-term care every 30 days. So there's a daily progress note for the patient while in-house. These are the orders for each day while the patient was in the hospital or in-house. And it shows on the last day she was discharged home. You always look for that last note to say discharged wherever. So, based on this information, what ICD-10 CM codes did you come up with? And what CPT? Now this is inpatient, so there should be an ICD-10 PCS, but I don't teach PCS coding. So if any of you got it, whoops, then you guys have it there. You guys can add that information there. All right. So for ICD-10, because it stated that the patient had acute and chronic cholecystitis with cholelithiasis, I got K80.12. And because the path report showed it as gangrenous, there's an additional code that you can add to identify gangrene, which is K82.A1, and that's it for the gangrenous. Now you use that as an additional code. They also said that your patient had hypertension, I-10. Patient was treated for low calcium, and she had to be given intravenous calcium, 87.6. She also had an UTI, as well as the UTI grew out E. coli, B96.20. All right, so did all of you catch all these codes? Again, your acute and chronic cholecystitis, K80.12, with lithiasis, and because it was gangrenous, K82.A1. She had hypertension, I-10, hypokalemia, E87.6, a UTI, N39.0, and it grew up E. coli B96.20. Okay, and then she had a laparoscopic cholecystectomy, which is 47562. And then I'll leave it for those that are doing ICD-10 PCS. I started to put it on here, but I'm not because I teach for the CPC exam, which does not teach ICD-10 PCS. But PCS, remember, is for facility reimbursement. But again, I'm a CPC coder, which means I teach CPC, I prepare codes for my physician to get reimbursed. So based on these diagnoses, he justified the laparoscopic cholecystectomy, the removal of the gallbladder. All right, your multiple choice questions. Question number 1, the blank is a statement sent to the provider to explain payments made by third-party payers. Guys, that is a remittance advice. This remittance advice is sent to the provider. Okay, number 2, computer-to-computer transfer of data between providers and third-party payers in a data format agreed upon by both parties is called electronic data interchange. B, electronic data interchange, EDI. Number 3, the blank refers to a statement sent to the patient to show how much the provider billed, how much Medicare reimbursed the provider, and what the patient must pay the provider. And in this case, it's a Medicare summary notice. Medicare summary notice. Number 4, the term used to indicate that the service or procedure is reasonable and necessary for the diagnosis or treatment of illness or injury consistent with general accepted standards of care is medical necessity. And we hear quite a bit about medical necessity now because, again, if the need wasn't there, I'm finding third-party payers aren't paying. There needs to be a medical necessity for everything that's being done now in healthcare. And number 5, the correct coding initiatives, we call them CCI edits, contain a listing of codes under 2 columns titled Comprehensive Codes and Component Codes. According to the CCI edits, when a provider bills Medicare for a procedure that appears in both columns for the same beneficiary on the same date of service, then the answer here says that you code only the comprehensive code. Code only the comprehensive code because it includes the component codes. All right, guys, I hope you were able to answer these and got them all correct. Any questions or concerns, feel free to comment below or email me at codemastercoach@gmail.com, and I'll gladly answer your questions. And don't forget, Codemaster Coach will be starting her next cohort of students on September 13th. So if you're interested in becoming a CPC coder, certified professional coder, email me at codemastercoach@gmail.com, and I will gladly send you some information on my medical coding program. Okay, guys, thanks. I will see you in the next one.